Welcome back. We are pleased to have with us David Weeks, Senior Vice President, Chief Technology Officer at NASCO. David, welcome.
Great, thanks. Good to be here.
Thank you for joining us. David, you're NASCO's Chief Technology Officer, which means you're responsible for technology innovation and digital transformation, and ensuring that you successfully secure and architect your products for the future. This past spring, you announced a groundbreaking consortium in healthcare. Please tell us about that.
Yeah, we're pleased to. So it's called the Coalesce Health Alliance. We announced it in the spring, but actually been working for about 6 months before that with some of our existing customers. NASCO provides digital healthcare solutions to some of the Blue Cross Blue Shield health insurance companies. And like a lot of companies, we were looking at what blockchain can do to both enable or disrupt existing business models, and we said, well, one of the things that enables blockchain is the business structures or consortiums that run that. And so we put together the governance framework for that consortium and kind of tested it out, tried to get some of the issues worked out, and then we announced the consortium in the spring time frame.
Well, even better, more companies ought to do that, make sure things work before they announce it.
Yeah, thank you.
And how large is the consortium now?
So the consortium is made up of, in addition to NASCO, there are 6 other companies. There are 4 Blue Cross Blue Shield plans and 2 PBMs. The Blue Cross Blue Shield plans are Massachusetts, Horizon, which is New Jersey, Michigan, and we're looking to bring on board Highmark, which is Pennsylvania, and then Express Scripts and Prime Therapeutics are also involved.
Perfect. And you're focusing on the payment side.
Yeah, the payment side, our use case is around a concept called distributed accumulators, but the way to think about it is, kind of your experience as a patient or a person receiving healthcare services. So a lot of people experience when you go to fill a prescription and you have to pay at the pharmacist, there's some confusion sometimes about what your copay is or how much you owe, and sometimes then they have to actually correct it. And that's because behind the scenes there are systems that are reconciling data between the pharmacy organizations and the health insurance companies that's to do with your health insurance benefits and where you are in your deductible. And sometimes they get out of sync. So when you describe something like that, it seems to be a good use case for blockchain, which is about distribution of real-time data, trusting the information, getting consensus on what the right information is. So we picked that one because it was kind of in a sweet spot for the organizations we work with. And then when we announced the consortium in March, April timeframe, it was because we completed a successful alpha pilot around that. So it established a working blockchain solution. It wasn't necessarily connected to any systems yet, but it proved out the blockchain technology.
Perfect. Tell us more about that alpha pilot use case, please.
Yeah, so the use case is the idea being that you'll have a blockchain ledger that holds the balance of your accumulators in real time, so that if any party, and it could be a pharmacy company or it could even be like a dental or vision provider, who joins the consortium as part of it, can basically read that information in real time, and that means they're not relying on out of date data to process the information. And so the pilot was basically just to prove that out, to say, is blockchain a technology that could do this? Could it be built? Would it be able to scale? And so that's what we proved out in the alpha pilot, and now we're moving on to kind of the beta phase, which is more of a pre-production phase of the project.
Right, terrific. As you've been watching the development of blockchain from its infancy, where does it grow from here? What should we be watching for as consumers, as healthcare consumers?
Yeah, that's interesting because a lot of the blockchain solutions will probably be experienced by consumers through things like mobile applications or mobile solutions or websites. So you may not even know that behind the scenes blockchain is actually doing some work to make it more efficient. Where you may see it as a consumer is around things like the tokenization of information or around payment. So people are generally familiar with Bitcoin around blockchain, so as a payment technology. And so you can actually use blockchain to create maybe some different payment methods. So as a consumer, you may see that, but my view is a lot of it you won't actually see. It'll hopefully just result in a better experience for you in whatever industry you are in. In healthcare, it means that the information is more accurate. You can find information, say, on a doctor, on a provider directory more accurately, which is a frustration today for a lot of people. Where do I find doctor information? That's actually a use case of one of the other consortiums, is looking at provider directory information.
Right, that's wonderful. I think one of the issues that consumers have had with blockchain is it's an education issue. It sounds very difficult to grasp, and the only use case that has been of any practical import is around cryptocurrency.
Yep.
And ultimately cryptocurrency is a relatively narrow use case for blockchain, isn't it?
Yep, that's right. Yeah, I think if you can think about it, I like to think about it in two ways, which is not the implication and implementation of technology can either be to improve an existing business process, so like we're doing with the accumulator, so there's some financial reconciliation that needs to be done better, or you're creating a whole new business paradigm or business model. And so blockchain has the capability to do that, but so do other technologies enablers. But the way you approach that problem is very different from a technology implementation perspective. And I think that's the value of the consortiums, is if you can get the organizations working together in industries to decide which ones to approach first as a group, then you'll get much quicker implementation, because now you've got a business network set up and it's not just a technology implementation.
You're not only making progress, but you're herding cats successfully.
That's right, exactly.
So you ought to be congratulated. David Weeks, Senior Vice President, CTO of NASCO, thank you for your time.
It's a pleasure, thank you.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. IPSI US, the Association of Independent Workers, for one, for all. Partners in Digital Health, publishers of the forward-reaching blockchain in Healthcare Today and Telehealth and Medicine Today. Special consideration to iWorker Innovations, taking the independent workforce to true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. And a special thanks to 1-800 Public Relations for all your PR and media support. We'll be right back after these messages. Don't go away.